So yesterday we had a provincial press briefing, first one, remember, we said in 6 months, with really not much to announce other than the fifth booster shot and the fact that it's now going to be every week going down by 5 years, starting off at 75 plus, working its way down. But beyond that,
well, basically,
they
held a press conference to tell us that they plan to do nothing.
That's for all intent and purposes, yeah. And not laughing at this because obviously this is still a serious issue, still hospitalizations today. We had more deaths today. Dr. Don VINH, who you may have heard from time to time here on the radio station, may have seen some stuff he's written as well. I want to be fair to say has not always been on the same side as far as the Quebec government is concerned with how they're dealing with this, and I don't think that's changed now. He's on the line. He is an infectious disease physician and medical microbiologist at the MUHC, and he's also a scientist at the Research Institute of the MUHC. And Dr. VINH, look, to be fair, you've had your issues with the government and the way they've handled this. What's the issue now? Are they not taking this seriously enough, as Natasha said, by basically having done nothing yesterday?
Well, I'm glad you raised that point because I have been in agreement with some of the decisions that have been made over the last 2.5 years by the government. I think some of them have been actually brilliant. On the other hand, that brilliance was a long time ago. What we've seen in the last half year or so, or since November actually of 2021, is just a slow removal of public health measures and a slow removal of any interest in addressing with COVID.
Okay, so yesterday we have public health. All the big players were there to announce, as I said, this fifth booster and when it would be available. What do you think should be happening now? Because there's been a question of kids going back to school. We know things are likely to get worse before they get better. What should be happening now?
Well, I'm glad that yesterday there was that the Premier announced that, reminded people that people need to get their boosters. What we have to realize is that the 2-dose regimen is not considered fully vaccinated. It requires at least 3 plus additional booster doses based on the time since your last dose. That has been the key message that us in the field have been trying to put out. That is unfortunately something that hasn't been consistently conveyed by those in charge. Yesterday it was a recommendation to get a booster, but why now? Why didn't we get boosters at the start of our wave and perhaps have blunted the impact of the BA5 wave? There's a few issues, but nonetheless, at the end of the day, yesterday's recommendation for people to get boosters is what we all want.
I have to agree with you with it being late. Like CEGEPs are back today, so if they're worried about the back to school season, we're in it. But Dr. VINH, I'm wondering your response because we always get texts from people saying, "Enough with the boosters. What's it going to be? Now it's 5. Is it going to be 15?" What do you say to people who say, enough with the boosters?
Well, unfortunately, the vaccines that we have put us in this situation that we're unfamiliar with. But the question is, are we really unfamiliar? How many of us take medication? A lot of people. Now, when you take an antibiotic, do you take 1 dose? No. You take your antibiotic until the infection is gone. When you take blood pressure pills, do you take 1 dose? No. You take the blood pressure pills until your blood pressure is controlled or gone. Because high blood pressure isn't ever gone, you're essentially taking the pills every day. Why am I making these analogies? Because at the end of the day, the concept here is that you take a medication until its effect wears off, and then you take your next dose of medication. That is the philosophy of any medication. And guess what? Vaccines fall into the category of a medication. Right now, with the vaccines that we use, the protective effect is finite. It is discrete. It is not unlimited like with previous vaccines to other pathogens. For this, it's discrete. And so because the protective effect wears out after a certain amount of time, it's actually not a strange idea to just take the next dose. Obviously, the question is, how long do we continue to do this? Well, that's why we need research and development to develop better vaccines so that we don't do that. But until we're there, this is what we have.
So the research you have now tells you that the vaccine you take remains in your system for how long, and at what point do you then have to go and say, okay, I need to get that booster? What's the date on this? What are the number of days?
Well, that's the problem, is that we have to look at it as this is not a function of the vaccine. This is a function of how well does the current vaccine work against the current variants, right? And because the variants keep continuously changing, the answer keeps changing. And it's not changing because, science is weird or whatever. It's changing because the science has to adapt to the reality of the situation. As variants become more and more evasive, that means that you need more and more or higher antibodies and higher quality antibodies to be able to fight off the variants that keep coming out. And that's why you need to have booster doses. Now, will it come to a day where we have, vaccines that don't require as frequent because they function in a different way or target different things? Yeah, we certainly hope so. And there's some promise, with the next generation vaccines. But again, we're not there.
What would you like to see beyond the boosters?
Well, we have to remember that the vaccines help to prevent against severe disease in most people who can respond to the vaccines. Immunocompromised people, for example, have trouble with that. And we also have certain medications that help to prevent help save your life if you have severe disease. But the point is that with all of these severe diseases, that still puts a risk or a burden on our healthcare system. And we have seen in the last wave that our healthcare system almost crumbled because when people get sick in the community, that also includes healthcare workers. And so when you have an increase in the number of patients who are in the hospital with COVID and you have fewer healthcare workers because of COVID, that's not sustainable, right? So we ask people, can you get your vaccine dose? Can you just be up to date? If for no other reason to protect yourself and your loved ones, but to protect the healthcare system, that's essentially what we want to see.
Okay, so we asked the question the other day because this is a two-pronged question. We know that there is a vaccine apparently in the works that the UK said they're going to have these doses hopefully by November, possibly December, to deal with the BA.5 variant now from Omicron. And I think we talked to Dr. Labos, who said, you know what, there's really no reason to wait for it. This vaccine that we have now is still effective to some degree. But then in the U.S., the CDC comes out and says, you know what, they've kind of, I hate to use the word given up. They're now shifting the focus to people themselves. We know that the uptake here on vaccines is not as good as we would have liked to have seen, right? We heard these figures the other day. People not getting their third, certainly not getting their fourth. So I don't know why the expectation is that suddenly people start getting their fifth. But when you hear this from people, being a scientist, being a doctor, that they've just kind of said, enough is enough. I don't really feel the need to go out and get another booster. I had COVID once. I'm fine now. So why should I bother? What do you say to people like that?
Well, first of all, I can understand. I think, first of all, we're all fed up with COVID, and we're all fed up with hearing about it, and we're having to do something about it, like masks or vaccines. But the reality is, it doesn't. The virus does not care what we think, right? The virus is going to continue to perpetuate. So how do we actually get rid of it or control it? Well, we actually have to put in measures. It would be a bit naive to think that in the absence of measures, we're going to control it. That just think about that, right? That makes no sense whatsoever. And so when the CDC puts out recommendations that say, you know what, even though we're a public health agency, we're going to put the responsibility back on you, the individual, and you're going to determine what's safe for you. And if other people don't do what's safe for you, well, that's too bad for you. That's not really a good strategy to have because that's not going to get things under control.
Dr. Vin, I heard you the other night on CTV saying, and I'm paraphrasing, so bear with me here, but something along the lines of like, instead of the leadership we need, we're getting Lord of the Flies. What did you mean by that?
Well, when there is a crisis, you need a crisis leader. And that crisis leader has to be trained, to be prepared, and has to be able to mobilize a strategy to respond to the crisis. And obviously with the intention of succeeding, right? Because that's the whole purpose of a crisis response. That means that you need leadership. And when in the face of leadership, you have to make tough decisions. You have to make decisions that risk being unpopular, but for the betterment of the people, you'll still do it. Or you may have to make tough decisions where you have to, prioritize or ration A versus B. At the end of the day, we are a society. We live with other people. And one of the benefits of our society is that we care for each other. We have a healthcare system that allows us to get healthcare regardless of your, socioeconomic background. That healthcare system has been threatened, and it continues to remain threatened. But that is our jewel. And if we don't protect that, then we're going to find ourselves in a society without a healthcare system, and that's going to be a disaster. So what we need to do is say, okay, what can everybody do so that we can protect the things that are important to us, like our healthcare system, like our economy, like our schools? Well, we can do certain things, but we just have to do them safely. So that's what we want. We want the leaders to say, not everybody for themselves. That doesn't lead to a society. That's the opposite of a society. What we want is people to say, okay, we're all going to have to buckle down and do some things that are a little bit inconvenient for us, but it's better for all of us.
Wise words. Dr. Donald Vin, infectious disease physician at the MUHC. Thanks so much for the time, Dr. Vin. Appreciate it.